go. There we go. Hey guys, Dr. Shoshany here. So as you can tell, a little more cast. I'm easing my way back into seeing patients slowly. But let's go over Karina. She's a new patient today. Complaints of neck pain, migraines, and headaches ever since she had a concussion. Never been to a chiropractor before.
This is my very first time.
First time, so that's exciting. So what we're gonna do first is we're gonna look at your posture. So I want you to just stand up over there and facing me. Turn around a couple steps backwards. Okay, right there is perfect. Okay, and what we're gonna do is we're gonna do one. Okay, now turn your whole body facing the window. Okay, two, and now turn your whole body facing the glass door. Okay, good. Boom, and now facing the other way. Okay, good. Now you can have a seat right here, and then the camera can kind of pick up what we're doing, and I can kind of show you what we're doing. So the green line is the center of gravity, and red line is where you fall in relationship to the center of gravity. So you see where your head's at right now?
Yeah.
You know, that's going to put some pressure on your spine. Your head's going forward. So this is just a screening tool that we use. We also take x-rays in the office. So as you can see, she's got a translation in her head where her body should be. So it's going to put some pressure on there. So the takeaway from this is your head weighs about 9.5 pounds, is shifted forward about 1.5 inches. So your head is effectively weighing 22.3 pounds instead of 9 pounds. A lot of pressure is being placed, exactly, a lot of pressure is being placed in not just your joints and muscles, but also your nervous system. So do you find that these are always chronically tight?
Yes.
Okay. Yeah, right in here. So these are called trigger points, and trigger points tell me that your body's trying to correct itself. Let's see what your rotation looks like. Turn your head this way. Turn, 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 all the way, maximal. Okay, good range of motion. Now come this way. Turn, 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 turn. Okay, good range of motion. Down, chin down to your chest, all the way down. Okay, so you have good range of motion. Bring your head back into extension. Good. Does it hurt when you kind of squeeze back like that a little bit?
Not really. Mostly
Okay.
when I move it forward.
Okay, good. When you move it forward, it hurts.
Yeah.
Okay. So you definitely have a misalignment in this upper cervical spine right here. Bend your head that way. This doesn't hurt when I go that way?
No.
Okay. How about when I kind of go that way?
Yeah, that's
A little more sensitive.
Yeah.
Okay. Gotcha. This way, and gotcha that way. Right in here. So upper cervical atlas C1. I think what's going to be the best adjustment for you is we're going to do a seated adjustment. Before we do that, let's go face down. I want to look at the rest of your spine. We'll do that seated adjustment in a minute. That's a pretty wild one. So I'm sure everyone out there in YouTube land is just wondering how can we adjust people different ways all the time. We're going to talk about that in another video because it's not one size fits all for everybody here. Some people benefit better from seated, some benefit better from face down. It's whatever the patient really needs. So you really don't have a lot of lower back discomfort?
No.
Okay, good. You know, she's young, she's healthy, the lower spine looks pretty nice, pretty balanced, doesn't seem like there's any gross misalignment in here. And obviously you work out and take care of yourself, so that's also another factor. Not here, more kind of like up in here.
Mm-hmm.
Okay, so sit up straight. We're going to go straight to that seated adjustment. Okay, right there. Great. All right, so this is going to be loud, so I'm going to try not to let the floor move. I want to pick this loud up. When I tell you to, I want you to take this arm and I want you to kind of just drop it, okay? Take a nice deep breath in, relax your head, drop this head down. There we go. I know you felt that.
Yeah, I did.
You know, it started to move right before I adjusted it, and I followed through. So that's Atlas. Okay, great. Now we're going to do the lower cervical on the opposite side. Breathe in, relax his head down, drop, 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 drop. That was the rest of that. Okay with that?
Yeah.
Okay, good. Now let's go face down once again. All right, so you just saw I did a seated adjustment of the Atlas. We did a Gonstead seated adjustment, which was awesome. And now I'm going to do the upper thoracic spine. So depending on what the person needs is what I give them. It's not one size fits all. She's never been to a chiropractor before. That I felt with her laterality of her Atlas would probably be the most comfortable adjustment. Okay, now this is going to be the upper thoracic. So drop this arm down, breathe in, drop, let your air out, drop, down. There we go. Got it, beautifully. And I still can't adjust confidently with this hand, so I'm just going to come along on the right-hand side. Take a nice deep breath in, let your air out, drop it. There we go, good. Back in the middle, and let your air out. Bend your knees. Good. All right, cool. Face, stand up now and tell me what's different.
A lot less tension for sure.
Okay.
I feel like I have more mobility. Yeah, this side feels a lot more relieved.
That is the right. So if you, let's look at this over here. So the spine here, you turn around so you can see. So the bone that I adjusted was the atlas. This is the top bone in the spine. So your bone was kind of slightly shifted to the right. So we just kind of put that back right in. Take a lot of pressure off the brainstem. You could breathe better, see better, feel better. So that's just one visit. One visit will have somewhat of an impact. But for this to be truly effective, you're probably going to do this a couple times.
Okay.
All right? All right, guys, so more videos to come as I get better and better and get back to practice. I would imagine but within the next 2 to 4 weeks, more like 4 weeks, I'll be back in the office full-time adjusting. I popped in to, see how it feels to adjust. I'm not 100% there, but I will be. See you in the next video.